play.
In Illinois, by law, unused medication cannot be donated and must go in the garbage. But 38 states have a way to donate medications you don't use to someone who needs them. 13 News reporter Richard Bodie spoke to pharmacists about why a drug repository program is needed right here in our state. Richard?
Yeah, good evening, James. When medications are prescribed, it's assumed that they will work, but for a variety of reasons, a patient may stop using a certain drug, and now that old prescription is no longer needed. But someone else could use that medication. It's why pharmacists say a drug repository program could be helpful in Illinois.
This is a very valuable finite resource that is now being disposed of.
Life-saving medications are being tossed away in Illinois, but House Bill 119, also called the Prescription Drug Repository Program Act, would give people the option to donate unused medications back to be used by someone else.
This is just another avenue for Illinois healthcare to be able to help with those who are in need and especially can't afford their medication.
The program would accept a variety of medications from cancer drugs to insulin, and the Illinois Department of Public Health would oversee the program.
There'd be quality measures to ensure that the medications are still within date and of good quality.
But not every medication would be accepted. For example, controlled substances like Oxycontin and Xanax wouldn't be. Swedish-American oncology pharmacist Elizabeth Lindquist says one of the benefits of the program would be that people who need high-priced medications wouldn't need to wait for prior authorization from their insurance companies.
A lot of times, there will be a wait, and if you are a metastatic cancer patient, you don't have time to spare.
That's because you might be able to get a free supply from a prescription drug repository while your insurance goes through.
The Illinois Pharmacists Association is a proud supporter of this legislation,
creating a future where no one goes without a medication they need.
Now, House Bill 119 was only filed 23 days ago, so it'll have to go through hearings and readings in Springfield before it can even be voted on. But one thing I do want to point out is that Democratic State Representative Maurice West is one of the co-sponsors of this bill. I also reached out to Republican State Senator Dave Severson, who said he was interested in the program, though he had not yet had a chance to read the bill in its entirety. So still a lot of work to be done on this bill and this program. But for now, reporting live in downtown Rockford, I'm Richard Bodie. Back to you.
Richard, thank you.